Yeah, good evening to everybody. So, our topic presently is hydrocephalus, and as we have we have already seen some basic anatomy initially. We will again try to talk some basic anatomy. This is a sagittal section of the MRI brain. This is a T1 weighted image. You can see this is the gray matter. This is the subcortical white matter. This is the corpus callosum. This is the lateral ventricles. This lateral ventricle joins the third ventricle through foramen of Monro. Through the third ventricle, there is another foramen called as the aqueduct of Sylvius. This particular structure is the aqueduct of Sylvius. I will try to use the pointer here. All right. So this is the aqueduct of Sylvius. This third ventricle communicates with this fourth ventricle, this triangular structure through the aqueduct of Sylvius, and through the fourth ventricle, the CSF flows down through the fourth ventricular outlet, this particular passageway. Another pathway of CSF is from the fourth ventricle. There is another pores or foramens which are present in the roof of the fourth ventricle. This is in the midline. There is foramen of Morjandi, and in the lateral aspect there is foramen of Luschka. So M for Morjandi, which is in the midline, and L for lateral, that is Luschka. So through this, the CSF goes from the fourth ventricle, and then it enters into the subarachnoid space. So the CSF initially travels through the lateral ventricle, foramen of Monro, third ventricle, aqueduct of Sylvius, fourth ventricular outlet, goes into the spinal, around the paraspinal spaces, and through the foramen of Luschka and Morjandi to the subarachnoid spaces. Now, this is the initial anatomy that we should be oriented about. Yeah. So this is another slide. So this particular slide tells us about how CSF is formed and what are the old theories of CSF drainage and what are the new theories of CSF drainage. So this is this particular structure that we have mentioned, that the lateral ventricles. This particular structure is the fornix. So the CSF is formed by a structure that is called as the choroid plexus. So this is the choroid plexus, which generally are present in the floor of the lateral ventricle. It winds around the floor of the lateral ventricles through the anterior part of the fornix and goes and lines the roof of the third ventricle. So this particular structure forms the CSF. The CSF now, after being covered all these pathways that we have already discussed, choroid plexus is also present in the fourth ventricle. You can see here one of the roof of the fourth ventricle. So CSF, as we have discussed already, the pathways. Now the CSF goes into the subarachnoid space. These areas are the subarachnoid spaces. Now in the midline, there is a structure called as the superior sagittal sinus. This particular grayish area you can see, this is the superior sagittal sinus. Now this superior sagittal sinus, it is a dilated venous channel which is formed by folding of the dural sheath. The dura of that is the covering of the brain. It folds into two. It splits up, and it forms this particular structure called as superior sagittal sinus. And there are other inferior sagittal sinus, transverse sinuses, and other venous channels, which are large venous channels. So these inside have undulations. You can see these undulations generally makes the absorptive area more. The area, it increases the absorptive area. So the CSF goes from here and ultimately drains into these undulations, which are called as arachnoid granulations. So the CSF enters this venous channel, that is the superior sagittal sinus, through these undulations. So this is you can see the structure. This is the microstructure of the choroid plexus. These are the capillaries. This is the basement membrane, and these are the epithelial cells. The CSF generally forms by ultrafiltration from the capillaries, and then they are drained into the arachnoid granulations. So this is the classical model that we have seen and known. Apart from this, presently there are multiple other diseases which this model does not explain properly. So there are parallel hypothesis and study that is going on these other models. That is, the CSF also flows from the dural sheath. So the dural sheath generally continues through all the spinal nerves, the cranial nerves actually. So this is the olfactory nerve that you can see, the dural sleeve that continues through the through and around the olfactory nerve. The CSF goes from there, and then generally it goes into the nasal mucosa. So in the nasal mucosa, it is having a fluid blood supply. So the CSF generally drains through the nasal mucosa it gets absorbed into the blood supply, and then generally they are being drained into the deep cervical lymph nodes. Apart from this particular cranial nerve, you get to see other cranial nerves also. The dural sheath, they are draining the CSF. So that is another pathway. That is a new pathway. There still studies are going on. That is called as the CSF glymphatic pathway. Another pathway, that is this particular subarachnoid space. You can see the dura. This is the pia. Then in between there is the arachnoid space. There are multiple vessels that goes through the arachnoid spaces. So these vessels also drain the CSF. So these are all newer pathways that have been already studies are going on. So abnormality in all these pathways will give rise to something called as hydrocephalus, that is accumulation of fluid inside the brain. So as we have spoken the same things, this is the classical pathway, arachnoid granulation, CSF drains into the arachnoid granulation whenever the CSF pressure is higher, that is 3 to 5 millimeter of mercury. The other pathways we have spoken about are the dural lymphatics, the contemporary pathway. There is the CSF that drains along the dural sheath of cranial nerves, and also around the mucosal vessels of the nasal cavity, and further into the deep cervical lymphatic pathway. Another pathway is, they have proposed that these you can see these these are the ventricles, the lateral ventricles. There are multiple small cystic pockets of CSF filled areas. So these are called as the Virchow-Robin spaces. So generally, what happens is these spaces are the vessels are present in these spaces, and around the vessels, the perivascular region, the CSF accumulates in these areas, and finally they drain into the capillaries, drain into the vessels. So this is the Virchow-Robin spaces. The other pathways that are present that have been proposed are epidural venous plexus that we see around the spinal cord. They also drain CSF, and also into the capillary, as we have seen, also into the capillaries lining the brain and parenchyma. So this is how these Virchow-Robin spaces are actually in structure. These are the vessels in those periventricular region. You've seen the photo. These are the periventricular region. The vessels are going. So the pia matter, they generally goes to a certain distance around these vessels. And the CSF is generally this funneling of the pia. The CSF accumulates in these regions, and then they are generally absorbed into these vessels, finally going into the deep cervical lymphatic system. Now, hydrocephalus can be of two types. Either it can be an obstructive one. Now, in obstructive hydrocephalus, there is something which is present from the area where the CSF is forms, that is the choroid plexus, till the area where it is getting drained, that is the arachnoid granulation. So in between these two structures, if there is something which is standing on the way, it will cause obstruction. So obstructive hydrocephalus is also called as non-communicating hydrocephalus. That is, the block is proximal to the arachnoid granulation. The other type of hydrocephalus is called as non-obstructive hydrocephalus, which is also called as communicating hydrocephalus, because there is no obstruction. So the entire channel is communicating. So that is called as communicating hydrocephalus. So what is the reason behind it? It can be because of defect in the absorption by the arachnoid granulation. The other type of hydrocephalus, the one we have seen that there is subnormal CSF absorption. The problem is in the arachnoid granulation. The other part is CSF is getting produced more than usual. That is, if there is a tumor of the choroid plexus itself, that is a choroid plexus papilloma, there will be hydrocephalus. And then there are a lot of congenital problems that have a very high association with hydrocephalus. We all know about Chiari 1 and Chiari 2 malformation. Chiari 2 malformation, they generally present with myelomeningocele. They will have brainstem herniation. They will also have very high association with hydrocephalus, around 40 to 50%. KRE1 malformation will have descent of the cerebellar tonsil. There will be syringomyelia, along with associated hydrocephalus. Then we have already seen aqueductal pathway, this particular structure that we have seen here, the aqueduct of Sylvius, from the third ventricle to the fourth ventricle. So if there is a stenosis in this particular area, either it can be because of a glioma, like glioma in the brainstem, or in this particular region, which is called as a tectum, or a tectal glioma, or any even any pineal region tumor, large region tumor which is pushing the tectum, or if there is a congenital aqueductal stenosis, or there is any infection which is causing sediments into this area and causing stenosis, there will be hydrocephalus. But these kind of hydrocephalus will involve the lateral ventricle, the third ventricle. However, the fourth ventricle will be in a normal size or shape.